Hi, everyone. My name is Katie Brumfield, and I am the manager of the Colorado School of Public Health Career Services. And today I'm talking with Natalie. Natalie, if you would please start off by introducing yourself to us.
Yeah, well, thank you for having me. My name is Natalie Tsevdos. I graduated from the Colorado School of Public Health in 2014, which feels like a really long time ago at this point.
Yeah.
I concentrated in animals, people, and the environment, and now I'm currently working for the City of Aspen in our environmental health and sustainability department. And I kind of have a dual role. So I'm the food program manager and the air quality program manager. So I work in those two different, very different areas.
Is it a pretty small department?
It is, yeah.
Yeah.
Yep.
Yeah. That's what I feel like most of them have those dual kind of positions.
Yeah.
So tell us what inspired your career path in public health. Almost 11 years ago, you graduated.
Yeah, I know. Yeah, so I didn't really know a lot about public health until my senior year of college, and that's kind of when I learned about it as like a potential career path.
Yeah.
I think I became interested because I like the community aspect of it. Like I thought it would be it's really motivating to think about like the impact that our work has that, reaches community wide. And I also just liked that there's so many things that public health encompasses. So I felt like, oh, there'll be like a lot of cool opportunities and a lot of like potential jobs that I could get into.
And that is true. I
Yeah,
mean, you will not get bored in your career path because
that
you
is true.
can do lots of different jobs. And it's so funny because alumni always tell me I never thought I'd work in blank, and I do, and I enjoy it. So
Yeah.
it's really diverse, which is great. Could you walk us through what is like a typical day? And I know that's like kind of a loaded question because there's really no typical day in public health, but sort of a typical day in your work.
Yeah, yeah. Yeah, that's so true. And one of the things I love about the job is that every day is kind of different, so that certainly keeps it interesting. So with my dual role, it kind of, it just depends. Sometimes I'm out in the field, so I might be doing a restaurant inspection, or I might be doing a site visit of some kind. We also have a few air monitors that we maintain. So we have a pretty small air monitoring network here, but those are things that we have to go maintain that equipment. And then there's also the like kind of office part of the job and more of like the program management part. So, coming up with our budget, thinking and planning for what we want to do next year. And so that might involve like applying for a grant or something like that. So I like it because I get out of the office, but then I also have some more quiet time where I can like plan and strategize.
That's awesome. I
Yeah.
bet you run into celebrities in Aspen too.
A few times.
Yeah.
Yeah.
So could you talk a little bit about how you collaborate with other professionals like researchers or policymakers or healthcare providers or even like police, anyone, but how your
Yeah.
position does collaborate?
Yeah, so yeah, we collaborate a lot with other people. We are pretty unique in the state in that we're the only municipal environmental health department. So we're not a public health agency, and so we work a lot with our local public health agency, which is Picken County. That's where we're located, and so we work with them on a lot of things where our work overlaps. So like air quality, a very regional thing. We work a lot with them on like disease investigations. We also work with other health departments throughout the state, especially like our neighboring health departments when it comes to things like special event vendors and and again like air quality things that don't really observe those like county lines so much.
Yeah.
And then internally we work a lot with like are other partners that also regulate restaurants. So like we work with our liquor license authority, we work with the building department, and our special events department a lot. It just helps to all be on the same page and to like all help each other out where we can.
Yeah, no, that makes a lot of sense. What roles? Oh, geez, hold on, my computer just decided to jump. What roles does data, community engagement, or policy play in your daily work?
So all of those things definitely come into play quite a bit. I think our restaurant inspection program is really data driven by nature.
Yeah,
So we try to make sure to be efficient and make the best use of our time. We make sure that we're focusing on facilities or areas where we know there's the most like food safety risk. So we definitely look at the data to kind of help direct where we spend the most of our time. And then, not everybody might think of restaurant inspections and regulating as community engagement, but I do. I mean, we're very boots on the ground, like we're out there every day in the community interacting with people. And we do other things besides, regulate. We participate in community events. We do food safety classes and things like that. So we're out there a lot, just talking to different people about our programs
yeah,
and what they can do. And then policy is that also definitely comes into play. I think for us, it's really important to be able to pass local ordinances and have the support locally for things like our air quality. There's not a ton of like federal or state regulations around air quality,
right.
surprisingly. So we're able to, really pass local ordinances to address things like wood burning and restaurant grills so that we can try to decrease air pollution as much as we can.
Wow, very cool. I think, yeah, I mean, the community, they're going out to eat. That's like how people socialize and hang out and have
Yeah,
fun. And you definitely want
yeah,
to make sure you're not going to get sick.
exactly.
Um, what were some defining moments or like pivotal things that you've done in your career so far?
So I think my first job out of school, I worked for Garfield County over in which covers like Rifle and Glenwood Springs.
Yeah,
And at that time, they were just launching their local food program. So before that, the state did all of the restaurant inspections. So I was like the first like local person to ever do the restaurant inspections there. And it was actually a really cool
yeah,
opportunity because I feel like I got to have a lot of say and a lot of like decision making ability. And I got to really like see how to develop a program and like the thought that goes into that. So that was like a really unique opportunity that I had.
yeah,
And I also think a few years ago, I became a manager. And so hiring staff for the first time, and that really, it's a big change. And it also like changed a lot of like the way that I think, again, when it comes to
yeah,
decisions, like my decisions are going to affect somebody else's job.
yeah,
So thinking about that, and then that also, kind of helped me like not only let go of things and like just kind of let somebody else take the lead on things, but I feel like it opened me up more to like new ideas, and just being open to that and
yeah,
like you know being open to somebody else's way of doing things.
yeah, and lots more responsibility too.
Yeah, yeah,
Yeah. Yeah, those are great achievements. And how cool to be like the founder or like the first to do that. Very
yeah,
good.
yeah.
Okay, let's see. Some general kind of public health questions. In your opinion, what are the most pressing challenges public health today?
Yeah, so I think one of the things that has always it's not even necessarily an emerging issue, but has always been kind of hard for me is just I feel like in the nature of public health is that we try to like prevent disease and prevent problems. And so sometimes our work can be very invisible. And I think that it can also lead to maybe a little bit of complacency of like, oh, well, that's not a problem anymore. And it's like, but if you stop supporting public health and we stop funding public health, like then all those issues that we work to prevent every day are going to come back. So I feel like that's kind of something that has always been the case with public health.
Yeah, yeah, I agree. Yeah. No. A lot of it is like if it's not affecting them, then they don't see it and they don't think about it.
Yeah,
Someone described it to me one time as it's like the sewer system. Like we have it, we need it, but we don't think about it. And
right.
I was
Yeah.
like, "Yeah, it's public health." Okay, what are the biggest trends or innovations you see shaping the future of public health?
Yeah, I think that I think one of the things that I'm seeing is like there seems to be a lot more awareness of like the human health um like impact of
Yeah,
climate change. And so I think there's a lot of opportunity for us as public health professionals to work more with like our sustainability counterparts and the experts in that field, just to make sure that we're working together and that we're you know, it being innovative and coming up with solutions together. Because I think there's a lot of overlap in what we do.
yeah, absolutely. Okay, so now we're gonna move on to some general career advice questions for folks that are watching this that are sitting there thinking, I might want to work in public health, or I'm interested a little bit, or I really want a job like you have. So what skills have been most important to your success in public health?
If I had to like pinpoint a skill or like kind of a group of skills,
Yeah.
I would say emotional intelligence is really, really important. So I
Okay.
think, and that to me kind of means like being a really good listener, being empathetic, being able to like not be reactive in stressful situations. I think all of that is really, really important, especially when, you know, when it comes to regulating people.
Yeah, yeah. Especially in those manager and leadership roles.
Yeah,
So
exactly.
maybe like communication skills too.
Yeah,
Yeah.
yeah,
Yeah, those people skills are very good to fine tune.
yeah.
Are there any specific tools or certifications or programs or trainings or anything kind of extra that you would recommend that someone entering the workforce could have? That would be really great.
Yeah, I think kind of along that same vein is just like don't only focus on like the technical job knowledge and skills, but just make sure that you're looking at like, you know, any leadership programs or
Yeah.
like communications trainings and
Yeah.
things like that. That's just as important as all of that other like technical job knowledge to be competent in your role.
Yeah, that's good advice. And how do you stay up to date with new developments or technologies or public health policies?
Yeah, so I think you know, kind of the two program areas I work in. I think just being aware of like what are the entities that like make up rules in that space. So like for us staying up to date with like the FDA and the state health department, because they're the ones that set a lot of the regulations that we follow. So just, you know, subscribing to all the right emails, and then any meetings or trainings or things that those groups are putting on, I definitely make sure that I'm a part of those.
Right. Yeah. All right. Are there any conferences or journals or professional organizations that have been particularly helpful in your professional growth or ones that you would even recommend?
Yeah, I think so for me, the Colorado Environmental Health Association or CHA, that's been like a great organization for me to be a part of. There's a lot of training opportunities and there's a really good annual education conference that they put on every year. And so that's kind of helped me like just meet new people that I probably wouldn't have met otherwise.
Yeah.
And then also like just learn about cool projects that other people are doing in the state. So maybe getting some ideas for stuff that we can do here and just you know, again, meeting different people.
Very cool. What advice would you give to someone just starting their public health career?
Yeah. So I'm gonna I'm gonna steal something that my boss says all the time.
Oh,
So he says he has a saying that's every day is an interview. And I really like that because I think that just being mindful of like how you're showing up every day, putting your best foot forward, being open to feedback and trying to implement feedback that you're getting, and just how you interact with people. I think all of that is really important to just be mindful of because you never know what opportunities might come up or, you know, who you might have to work with 10 years from now or who might
yeah,
be your boss later on. And so it's just really important to always be trying to put your best foot forward. And, if you're showing up and just trying to do the best that you can every day and meeting people where they're at, you'll definitely, be more likely to advance and have more opportunities as your career goes on.
yeah, that's good career advice. I'm just curious, so since you're now on the other side of hiring people, are there any tips for resumes, applications, interviews, anything you've seen that you're like, I really wish people knew to do this?
Yeah, I think the biggest thing is just make sure that you like research the job that you're applying for. And if there is a cover letter, like it helps to say why you want this job specifically.
Yeah.
I know from back when I was applying to jobs, like you have your resume and your cover letter, but it doesn't take that long to adjust them just a little bit. And that shows the hiring manager of like, I'm interested in this job specifically, and these are the specific reasons why, instead of a more general approach.
Yeah, yeah, definitely tailoring is key for
Yeah.
applications. Well, thank you so much for sharing your career path with us and the amazing work you're doing in Colorado. I hope to learn more and I hope we can keep in touch, but thank you so much.
Yeah, thank you for having me.
Oh.